I'm really excited to be here outside of Ady's house. We had traveled here to Santa Barbara. We were, I think, just a few hours from making our way over here to speak with him when we got word that he had been rushed to the hospital. Again, so relieved and pleased that we're able to be here today, just a few weeks after that. His voice has been really important, I think, for illustrating what's at stake in this healthcare debate. Hello.
Hi.
How are you?
Good, good. Welcome back.
Well, nice
It's an honor
meeting
to have
you.
you here. So my name is Ismar Barrios. I'm Ady's primary caregiver, and I work about 3 to 4 days here, and I'm here about between 50 to 60 hours a week.
Wow.
Yeah, so it requires a lot of care. Hey, Ady. Come on in.
All right. Hello.
Hey guys, good to meet you.
Thanks so much for having us
Thank
over.
you for coming.
Thanks for having us.
How have things been on the trail?
That's a loaded question. Great.
I will come in a little bit earlier to assist with the bathing and the transfers from, the commode chair to his wheelchair, or from the bed to the chair.
Well, sounds like he's lucky to have you on the team.
Yeah, I'm very lucky to have him too as well.
Do you or your family have any experience with serious illness or struggles with the American healthcare system?
Yeah, for sure. In fact, I got to tell you, this is the first time This is the first time I've been around a lot of breathing equipment since we lost my father in January. And it's kind of taken me back there a little bit. And we went through a period, a few months, kind of smack on top of each other, where my mom had a serious heart situation, wound up requiring a triple bypass. Right around the time we got a cancer diagnosis for my father. Only a few months passed between that and when we lost him. And a big part of what I was reflecting on during that period was that they're on Medicare. So as tough a time as that was for the family, all we had to think about was what was right medically for us. Although I'll say even then, I remember the conversation when we thought maybe my dad was going to live longer than he did, where we sat down with a social worker who basically explained to us at the hospital that in terms of long-term care, our best option was probably for our family to spend down everything that we had until we were asset poor enough to qualify for Medicaid, and that would be the best chance to get his long-term care covered. I remember just thinking, is that how this works in America?
Tell me about him. What kind of a father was he?
I think you would have liked him. He was an English professor. Maybe that's why I feel at home coming into a house lined with books. Very passionate guy, strong-willed, cared about politics. Was never politically connected, but he was always politically concerned. I think I picked that up from him. Him and Mom both.
Mayor Pete, something I appreciate about you is you are willing to have the tough conversations, even when someone doesn't agree with you. It seems like a cornerstone of how you present yourself as a candidate, that openness to debate. Coming all the way out to Santa Barbara, even knowing we have different perspectives on healthcare, that means a lot to me. And I have to say, I'm surprised and disappointed that Vice President Joe Biden does not have the same approach, because he's the only serious Democrat running for president who hasn't accepted my offer to conduct one of these interviews. Why do you think he is unwilling to have this conversation, and why are you?
Well, I can't speculate as to his decision-making, but I think it's important just because, first of all, this is the most important issue that I'm being asked about just constantly on the trail. And I'm guessing you view it the same way, even if we have a different approach on how to get there. But I think it's a healthy conversation to have, and especially knowing that you're in the middle of this debate in so many ways, I'm thankful to be able to do it.
As an undergraduate, you wrote an op-ed with this quote: "We could finally see a single-payer healthcare system that closes the gap between the US and other nations when it comes to medical treatment." How have your views developed since then on the merits of single-payer healthcare proposals like Medicare for All?
Well, I continue to think that it's the destination that's probably going to serve us best. The question on my mind now, though, is, first of all, how do we know we can set that up in a way that works for America? And secondly, how do we do it in a way that unifies rather than polarizes the American people? And third, maybe most importantly of all, what if we're wrong?
So that's the politics of healthcare policy. Substantively, I think part of the divide between Medicare for All advocates and proponents of other plans is how they see the role of the profit motive in healthcare. It is simply a fact that health insurance companies make money off of denying people coverage. Their entire business model is built on paying out less in claims than they take in from revenues. So, philosophically, why do you think we need to preserve private insurance companies, and how do you think they make our healthcare system better?
Well, I guess it's about delivery. First of all, philosophically, I don't necessarily think there's a need to preserve them. This is what I'm saying. Philosophically, I'm neutral. All I care about is that everybody get covered. And what excites me about the idea that I've put forward is, Medicare for all who want it, is that it creates a public alternative that, if people like me are right, will become almost inevitably the pathway to Medicare for all. But if in some way we're not, we'll be really glad we didn't force people onto it, or force people onto it before either they or the system were ready.
And what happens if the private plans try to keep healthy patients and make Medicare pay for everyone else?
This is the opportunity that I think we have through the economies of scale that are available, right? If the plan is better, then it should be resistant, just at the scale that we have, especially when it's folded in with Medicare, to be resistant to cherry picking. I've got to think that the private plans will also up their game in terms of family coverage. I say that because if you think about the history of public options beyond healthcare, whether it's what some of my fellow mayors have tried to do with internet service providers or kind of other cases from across the economy, a lot of times when you have just a lot of surplus on the private side, they improve their competitiveness when they know there's a public threat. That being said, I don't expect that the private plans will be likely to be able to fully compete.
Since my diagnosis, I have been thinking a lot about my legacy. I hope that people in my life remember me as someone who advanced the cause of justice. I'm curious. What do you want your legacy to be after you eventually exit the stage of national politics? How do you want to be remembered?
For me, I hope when they write me up that the story will be that I helped deliver the bold solutions to the problems that made it possible for us to even get here as a country, and that my arrival on the national stage helped unify the country too. That I represented the idea that we could do and had to do both of those things, to figure out a way to be called to a common project, and in the course of doing it, to solve problems that we have left unattended for decades or longer.